80% of people in India go through mental health challenges and never get to see anyone because they don't even know that what they're going through is a mental health challenge.
Exactly. Yeah.
You can go on LinkedIn. On your profile, you can write life coach, mental health counselor.
Yes.
Nobody will question you.
Yes.
If you go to a large hospital, the psychiatrist room will be in a corner where nobody else goes.
Yeah, absolutely. I
Right?
noticed that. Yes.
Yeah. That's why online works actually beautifully for this. We don't take any personal data. You can give me whatever name you want. We just need your phone number for login and you can get whatever help you need. Mental health is the diabetes of this century. If you're not investing now, you'll be left behind. So many students have come and told us that, you've saved me from doing something drastically wrong.
A startup that's redefining how India approaches mental health care. My guest today is Tarun Gupta, co-founder of Lissun. Tarun, thank you so much. Absolute pleasure to have you on the show.
Thank you for having me.
So before we get to Lissun and what Lissun does, let me ask you about your own journey, because you've done quite a bit before sort of zeroing in on the mental health care space. What's that been like?
So I grew up in Shimla. It was a great childhood, beautiful place to grow up. And then after my studies, through my first job, I went to the US, stayed there for around 4.5 years and wanted to come back to India. Did my MBA and then ended up working at a number of startups. I was at an early stage at Oyo, then went to Uber. But the reason Lissun was born was my own personal journey, and similar is the story of Krishna, who's my co-founder.
Right.
We both saw struggles with mental health up close. In my case, when our daughter was born, she is an extremely premature child. She was a 27-weeker, and we had to spend around 2 months in hospital before we could bring her home. And at that time, my wife and I went through extreme anxiety, not knowing what was happening. And that's when I realized how tough anxiety can be, because you always hear about it, but when you go through it, to the extent that one day I felt such a terrible pain in my chest, I actually went to the ER, thought I was having a heart attack. It's just stress.
It was a panic attack.
It was a panic attack. It was stress. We were people living in tier 1 metros with access to everything. And we just realized how helpless we were and how the existing solutions that were out there didn't really work for us in our situation at that time. So that was my big awakening that, this space is broken and we need to do something. Obviously, my personal circumstances were not such that I could start at that time. So, but the seed was born. Then I met Krishna. So Krishna's journey is also similar. His son was diagnosed with a speech delay. No other challenges, speech delay. And so when children have a speech delay, right, they can't express themselves by talking. So what they'll do is they'll touch you, they'll push you. He was working in Bangalore at the time at Flipkart. And they tried to get help nearby. The closest speech therapy center they could get was 15 kilometers away, which in Bangalore is, you can imagine the time. So long story short, what ended up happening is they actually ended up moving to Delhi to be closer to family. So he also went through that. And then both of us were working at Uber together. We connected on this, wanted to build in the space. And then when COVID happened, we saw something very similar among a much larger audience of people, right? A lot of people reaching out, not knowing how to get help. And that's when we decided that, this is the time to start. So we started 15th of August, 2021, and here we are 4 years later. It's been truly a privilege to do something in this space.
Tell me one thing, when you were going through your personal, challenges with your daughter, what is it that you realized about the healthcare space in India that was actually broken? Because obviously we know while things are much better now, people are actually talking about it, the stigma is less, there's still a lot that needs to be done.
Yeah.
So what were the realizations that came to you where you felt that, okay, this is why I need to do this?
So the very first question that I had in my mind was, who do I go to? I did not know. Should I go to a psychologist, to a psychiatrist, to the doctor who's treating my daughter? There is a very well-defined system on physical health, right? If you don't know, go to a general practitioner.
Yes.
Where do you go for mental health? So that was the first question. So our schedule was such that since the child was in the NICU, my wife used to be there in the NICU from morning to evening. You could not get hold of a psychologist after 7 p.m. So how do you go? You can't leave the child in the NICU. So we actually ended up not getting help. We subscribed to a Facebook group called Moms of NICU, which some people were voluntarily learning. That was our therapy.
One of the most important things that you've mentioned is there's something wrong, you need help, but you don't know what help you need.
Yes.
And that's the most important thing to figure out.
Yes, and that is what happens with 80% of people in India who go through mental health challenges. We call it unawareness.
Yeah.
So I know I'm not feeling all right.
Yeah.
I talk to, and depends on who you talk to. If you talk to people, my mother's generation, they will say, you should probably go to the temple or start doing yoga, etc. If you talk to people my generation, they will be, yaar, be strong, kya hai, ho jata hai.
Yeah.
And then if you talk to the next generation, they will kind of push you towards saying, why don't you see a therapist?
Yes.
That is the difference that is happening.
That is coming.
But if you look at stats overall, what the data says, 80% of people in India go through mental health challenges and never get to see anyone because they don't even know that what they're going through is a mental health.
Exactly, yes.
So that is such a big area that work needs to be done. Unawareness is the biggest reason why a lot of people don't. Then comes the second layer which you spoke about, which is stigma. And stigma is two-way, right? Stigma is what will other people say? And stigma is something that we've told ourselves all our lives that I am the strong one.
Yeah.
How can I have a mental health challenge?
Yeah.
I'm supposed to look after everyone.
Yeah.
I can't do this. Nothing wrong with me, even though we know we are breaking inside. So stigma is what we call as acceptance, which I am finding it very difficult to accept that I should go see a therapist. And stigma is what will others see. If you go to a psychiatrist, it's very funny. You should try this out. If you go to a large hospital, the psychiatrist room will be in a corner where nobody else goes.
Yeah, absolutely. I've noticed that, yes.
Yeah. They will open offices on 3rd, 4th, 5th floors where nobody goes.
Yeah.
So nobody wants to see outside a psychiatrist office. That's why online works actually beautifully for this. But that is the stigma that we live with.
Right.
And then I think for the last bit, which kind of has actually two more problems that exist. One, the quality control in this space is non-existent.
Yes.
Right?
Yes.
Like in the field of medicine, unless you have a degree, and there are multiple people checking whether you have a degree, whether you have the license to practice. Here, you can go on LinkedIn. On your profile, you can write life coach, mental health counselor.
Yes.
And nobody will question you.
Yes.
So everybody and anybody today is a life coach.
Life coach, absolutely.
They actually are doing more harm because this is a specialized field. You need to be trained. So psychologist, before you can get an RCI license, you actually need to study for 8 years. It's similar to doing an MBBS. So you do 3 years of bachelor's, 3 years of master's, 2 years of MPhil, and 1 year of residency. That is when you become a clinical psychologist. How can I, who's never studied psychology, just because I think I understand the world really well, I just write on LinkedIn, life coach, and people will start talking to me. And that is why a lot of people don't believe that, therapy works. Because a lot of the people who are doing this are not trained to do this.
Not trained. Yeah, that's a big problem. So actually, that's where Lissun comes in. So if you can sort of explain to somebody who's not heard of Lissun what it does and how can one approach the app if one has a problem?
Sure. So there are two sides to Lissun. One is the adult side, and then we do something in much, very, very deep work with children.
Okay.
So I'll come to the children later.
Yeah.
With adults, what we realized was this, right? That a lot of people don't come to know what they're going through is a mental health problem. If you see 10 to 20% of people realize that, I need a therapist.
Yeah.
The rest of the 80% do not.
Yes.
And we realized that if you want to create a large enough impact in this space, you need to somehow break this 80%. So what is happening with these 80% people? So I'll give you an example, right? Think of a couple who's been trying to have a child for 3 years. They've been having their own struggle. They can't talk to anyone in the family about it. They're having their own challenges with it. So then they decide to go for IVF.
Right.
The families look down on IVF also, right? So they're not talking to the family. One of the biggest reasons why IVF cycles are not successful is the level of stress in the couple as well.
Yeah.
So what we do is we kind of partner with IVF. This is just an example. IVF institutions. So any couple who goes to them for IVF also gets therapy.
Okay.
So we take care of the mental health parts.
Yeah.
So that is one use case. So what we've done is we've identified 3 large use cases where a lot of people who encounter mental health problems not knowing what they're going through as mental health come. One is healthcare. Healthcare.
Okay, healthcare overall.
Overall.
Okay.
So think of chronic diseases, think of cancer care, dialysis, etc. Number of use cases in healthcare where mental health is a big part of your treatment protocol.
Okay.
So we work with healthcare institutions a lot. Second is education. Everybody's heard about what is happening in Kota, right?
Yeah.
Suicides. A lot of people prepare for competitive exams in India. There we are working with coaching institutions because they are very, very high stress situations. Third is corporates. We work with employers to provide, support for their employees. There is very, very customized programs. So we work with employers on what they want to do. So for adults, these are the 3 main. Fourth, yes, we do a lot of work with psychiatrists. See, it's very interesting, adult psychiatry, right? So psychiatrists prescribe medicines. Medicines will help relieve your symptoms, will help treat you. But what works beautifully is a combination of drugs or medicine along with therapy.
So assume that I'm somebody who knows that, okay, I do need some kind of intervention, some kind of help, but I don't know what I need.
Yes.
So then how do I, how would I go through the process and I come on to listen?
So if you come to our homepage and you're trying to book help, we have a large banner even before you book. Click here to find out the difference between a counselor and a psychiatrist. So you on your own can then decide, do I need a psychiatrist? Do I first want to talk to a counselor? Once you've decided, we have on our platform, you can book with a counseling psychologist, with a clinical psychologist, with a psychiatrist. But that choice we leave to you. If you don't know what to do, we say, okay, just book a session. We will talk to you in the first session and we will guide you to the right person.
Right.
And because we have a full stack model, so we can actually guide you to the right person. So anyone out there who wants to directly seek help, just log on to our platform. It's very, very simple. To bypass the stigma, and there is a lot of issues about my data, what will happen. We don't take any personal data.
Okay.
All we need is your phone. You can give me whatever name you want. We just need your phone number for login and you can get whatever help you need on our platform.
Right. So there are a number of, I was also going through the app. So the number of, experts there who you can reach out to. How do I figure out who to choose? Because obviously there are various experiences, various levels of expertise. Any sort of tips on that?
See, on the platform, we try to give you all the information, like what does the person specialize in, what languages. Language is a very, very important barrier. See, when you have a mental health challenge and you're talking to someone, you will want to talk in the language you're most comfortable in, right? So we cover 20 languages in India so that you can speak to us there. So language, what the person is most comfortable with from the expertise side, how many years of experience do they have, etc. All is there. So it's very simple. Just log on, book your first consultation and you'll get the right help.
Okay. Now, let's go back to the point when, once you had decided that mental health care space, this is what you need to do. How did the idea of Lissun happen? How did you say that, okay, this online platform is what we need to do?
So we come from, there's a little bit of personal bias to that, right? We come from backgrounds where we worked with large online apps, Oyo, Uber, etc. And the way to scale initially for us was, okay, let's start online. Obviously, it's a function of money also, right? Offline is much more costlier than online. So we decided to do that.
Okay. So let's talk about some of your firsts in your entrepreneurial journey. The first day of building Lissun, what was that like?
It was crazy, right? Entrepreneurs are so glamorized, right?
Yeah.
It is nothing like what you see. It is, you are, on day one, you are the janitor and the founder of the company. So day one, I still remember I was trying to register the company. The MCA site was breaking. Parallelly, we were trying to figure out a place for rent. Nothing worked. And we were so used to our jobs, right? Most things work when you go to work for somebody. Most things are working. Here, nothing was working. And I said to my co-founder, if you and I can't make this work, why will people join us?
Yeah.
So day one was huge self-doubt.
Okay. The first employee you hired?
First employee we hired is still with us.
Okay.
Yeah, she was a psychologist. Somebody referred to us. And she now leads our operations in Lucknow.
Okay.
Yeah.
Okay. First pitch that you made, and how did it go?
Terrible. Like, I would not give myself money or sign up with me. So we were just learning, right? But thankfully, there were so many people who supported us in the ecosystem. The entrepreneur ecosystem in India is very, very solid. And I am very, very grateful to so many people who gave us time. Practice your pitch. Tell us, this is what you need to change. So that first pitch to where we are now is day and night.
So then what about the first pitch that went through that was successful, where you managed to raise money? What was that?
So money came later. I still remember my first client success, right? The first client. So we started in August. We had small clients, but our first large deal came through in December. So three and a half months of selling. And I remember once the deal went through, we were doing this for 3 months. It was a B2B deal with the IVF center. We were so happy. And then we didn't want anything to go wrong. So the next 1 week I spent at that IVF center making sure that everything is working like clockwork and not leaving it to anybody till, I was satisfied. So that's the amount of effort you put in deal one and then you subsequently do. With money, I think we were very lucky that a lot of angels who we had worked with, so our bosses from Flipkart, Uber, etc., like without knowing what we were doing, invested. So the angels were actually angels for us. And then our first institutional check came from Ivy Cap Ventures.
Okay.
We met them at IIT Delhi. Vikram, who's the MD there, he really liked us. And that's how the institutional journey started. But the pitches there were refined by a lot of our family and friends who, through as angels, gave us the money.
Okay. The first time that you felt that you've made a difference in somebody's life and that this app is something big or has a potential to be something big?
That is a feeling that has been reinforced multiple times. Okay. First time I still remember, this was with this IVF client. There was this couple who were practically on the verge of leaving each other because it's a very tough situation there, right? And there's a lot of marital discord. And they told us that your therapist saved our marriage. To me, that was a very big deal. Yeah. To the extent that Kota, so many students have come and told us that, you've saved me from doing something drastically wrong. Touch wood, the institutions we've been involved with through 3 years now, we've not seen a single suicide.
Okay.
At Kota. We've seen more than 20,000 students over that time. A tremendous feedback from them. A lot of them go out of Kota to their colleges, continue their journey with us. And now with children. Children who were not getting into school, the day they are discharged from the center and they go to school. Such happy parents.
Yeah.
So from that perspective, it's just so fulfilling to see the kind of impact we can create.
Yeah. Yeah, interesting that you mentioned Kota because obviously that's one of the most pressing issues, especially in these days. We keep hearing problems there. What do you think has been the change in terms of the coaching centers there, in terms of the families, in how they are approaching mental health while pursuing such a competitive exam?
See, the thing is, the difference has been that the coaching institutions have become more aware of how large the problem can be and how central to their business this problem is, right? So if you look at Kota enrollment, so over the last 4 years, the enrollments in Kota have gone down.
Okay.
Mainly because the negative news cycle that's associated with it.
Right.
Why is there a negative news cycle? Because mental health issues are there. So a lot of the coaching institutions, at least the forward-looking ones, have realized that this is not a good to have service. This is a must-have service if the business has to continue to thrive in Kota. And they've kind of partnered with, so some coaching institutions have built their own counseling teams. Others have partnered with players like us. We work with mostly all the large players in Kota now. And to the extent that they don't think of it as just a good to have service. The second difference has been the way I think we've co-designed the program with them. Earlier, and still in some places, what happens is there is a room where a counselor sits, students go to class, go out, they never see the face of the therapist. What we have done with these coaching institutions is kind of designed a program where mental health is part of the curriculum. So you have classes of physics, chemistry, you also have a class on wellness.
Okay.
Where we talk about things that are applicable to everyone. How do you settle into a new city? What happens when you go through your first breakup? If you are facing challenges with these things, how do you handle them? So you're giving tips to the full spectrum. And that's when a lot of students realize that this is me that they are talking about. And then they will come to the counselor.
Right.
So, we've kind of figured out what is the right way to break down that funnel. And then obviously the good thing also is with the next generation, they're much more open about seeking help, talking about it, telling their friends. So that also helps.
Right.
But you have to get through to them at that level.
Yeah. But in terms of, like you said, the next generation is changing slowly, but this obsession that in India we have, which is why Kota became what it became with all these competitive exams and engineering, doctor, all of that. Is that mindset slowly changing, whether from families, whether from the children themselves, of continuously trying year after year at the risk of,
Unfortunately, not yet. Because see, it is still for a lot of families for whom this will be the first generation person who will get on to a prestigious medical college or engineering college. This is their ticket to a better life, right? So for a large percentage of people, that still holds true.
Yeah.
So that pressure that, you are the only one. A lot of people come to Kota having sold off land. That is the level of...
So they have no other option, no other choice but
they
to succeed.
Put all their eggs in that basket.
Yeah.
So for a lot of them, it still continues to be true.
So what does the road ahead look like for Lissun? Where do you see it 5-10 years down the line?
It's, I think, we are at a very interesting juncture in the mental health journey of India as a country. 5 years back, mental health was the problem of the elite. Right? Who used to go to psychiatrists? Film stars?
Yeah.
That was the only people you know of. What is happening now is there's a lot of mainstream talk about mental health among adults. A lot of corporates are talking about it. A lot of coaching institutions are talking. So we see that this level of awareness will be created by the government, by private institutions like ourselves or coaching institutions or healthcare institutions. And this space will grow. Children, we are already seeing that happening, right? So the rates of detection of autism in India over the last 10 years have grown by 1,000%. It's not that more children are having autism. It's just that the diagnosis are improving.
Happening,
And now we believe that this space, just because the diagnosis is faster, more people are willing to take help. From our perspective, we'll be doubling down in the space. So in 2 years, we built 20 centers. The idea is over the next year to year and a half, build 60 more.
Okay.
Except Bombay and Chennai, we are in all metros. We've started a couple of tier 2 cities as well. So you double down on building these centers. Parallelly, we are building a solution on the tech side as well. Because see, not everyone can come to a center. And there are tier 2, tier 3 cities where this is a challenge. And with AI, you can build a very, very good solution.
Yes.
So a lot of work is happening on that side. And so we are building something very specific for parents of these children, which they can do at home.
Okay.
So we are very excited about where the space is going, where mental health awareness is going in the country, and we are doubling down on growth for us.
Okay. Let's get to a quick rapid fire. One-line elevator pitch for Lissun.
Mental health is the diabetes of this century. If you're not investing now, you'll be left behind.
Okay. The feature on Lissun that you're most proud of.
Giving patients the ability to figure out what is the difference between a counselor, a psychiatrist and a clinical psychologist, and giving them the ability to choose the right one.
Okay. A feature of Lissun that didn't work and had to be shelved.
We tried, self-help. Nobody wanted to pay for it. So we've given it free. We didn't shelve it. We've given it free.
Okay. Yeah. Your go-to productivity hack. One hack.
My go-to productivity hack is every day in the morning, and now with AI it's become very simple. I actually give myself a voice note of things I have to do that day. And before going home, I actually check through it.
Okay. Yeah. A dream partnership or collab for Lissun?
Dream partnership or collab, Deepika Padukone. She does a lot of work with mental health.
Yeah.
We would want her to work with us on the children's side.
Yeah. You think having such celebs who talk about it in the open and, it helps people break away from the stigma?
Even if it's not the stigma. See, stigma will take more time, but it creates awareness.
It creates awareness.
And it helps with acceptance.
Yes.
Like if she can have it, if Virat Kohli speaks about it, then I can do it as well.
Yeah.
Right.
An entrepreneur who inspires you.
There are multiple. Obviously, outside of India, it's Elon Musk. But in India, I've been super inspired by Ritesh. I've had the chance to work with him at OYO. I've seen him. So when I first went to OYO, he was 19, right? And I've seen, he was the most mature 19-year-old I knew. I was kept thinking, what was I doing at 19? And the way I have seen him evolve from 19 to where he is now, the sponge he is in terms of absorbing information of everyone. I'm very inspired by him.
How do you deal with doubt? I mean, you mentioned that day one was the day when you had a lot of doubt. But even post that, have there been moments where you felt, oh my God, this is just not going to work, or this is just too difficult to break through?
No, absolutely. See, entrepreneurship is like that, right? Your highs are insanely high and your lows are insanely low. What keeps you grounded at that time and what reinforces self-belief is two things. In my case, I have a very strong co-founder and we are each other's rock, right? We bounce ideas off each other. We talk to each other about what I am thinking and we kind of reinforce that belief in the mission and, what we are building because the value systems are very aligned. Second is my family. Whatever doubts I'm having when I go meet my 7-year-old, all doubts vanish, right? Yesterday, the thing she was most interested in was how my hotel room looked. So, life has many more things than a small success or doubt.
What advice would you give an entrepreneur or somebody who's looking to build something in the mental health care space?
I think build for the right reasons. See, if you are only building to kind of make fast money, mental health, or in general, health is not the space. Health takes time. Health is something you have to build with quality. If a Zepto order does not arrive on time, it's okay. Hell will not break loose. If somebody gets diagnosed incorrectly, for that family, it's hell breaking loose, right? So build with that mindset that what you have to build is very high quality. It will take time. It will take patience. It's not a journey which is very fast. And hence, don't compare yourselves to people who may have started with you and in different spaces and are growing much faster. Everyone's on their own journey.
So how do you balance, the social impact part of it? Because obviously this has a huge social impact and it's being done with that mission and profitability because it is a startup with a mission of profitability as well.
No, and I think both are important. See, you can have all the social impact in the world, but if you don't make money, you will shut down. Right? So we work with that mission. We have to make money in terms of the therapy operations that we run, but save money everywhere else. And that is why profitability to us is supremely important. So, for example, for all the centers that we run, you will never find us at a high street location. Why? We don't need to be. We'll find a good space, a well-lit space. It may be one lane behind high street, but it should have parking. It should have a great experience for parents and children should be happy there. So all those kind of hacks we do to save money and be profitable, because very clear that this will shut down if we are not profitable.
And finally, Tarun, in terms of, the moat for Lissun, obviously this is a space where you can never have too many people because you need to cater to the huge population of this country. But at the same time, how do you manage to maintain a differentiating factor?
For us, there are two things, right? One is quality. We don't compromise on it. Our interview process is extremely strenuous. Our selection rates are less than 10%. And quality is something we live and breathe by, like a very strong SOPs, very strong compliance, and we don't compromise on it. Not a single person on our platform will be unlicensed. Not a single person on our platform will be someone who there is a slither of doubt on. So quality, and then we take the same mindset to the physical spaces that we build. You will never find our center in a basement, for example. Like children should have happy places. So take that mindset, of quality, and that becomes one big differentiator. And that is why if you see, like in terms of our centers, 90% of our revenue comes from repeat customers because they love coming back to us. Then the second moat is, the technology that we are building behind this. So now we do more than 10,000 sessions a month.
Wow.
All that data is something that is powering our AI models. And we believe that in the future, see, AI models, a lot of great companies have built, right? OpenAI has built, Gemini has built. What you can get those models to do will be dependent on the data that you have. And we believe we have one of the richest data, if not in India, in the world. And those two are very strong moats for us.
Right. And I mean, you're just talking about AI, just one more question on that. There are a lot of reports where people are using AI and the latest generation of AIs as therapists, as counselors to get advice. What are your thoughts on that?
I don't think AI should be your only therapist.
Yeah.
AI will work beautifully to augment therapists. Today at Lissun, what are we using AI for? We use AI to help reduce the burden on our therapists so that they are only doing therapy. In our case, AI automates all notes. AI automates reporting. AI automates compliance. AI keeps a check on. So, for example, if the therapist has forgotten something on their screen, they will get a prompt. We are using AI to kind of make better therapists, and that to me is the use case today.
Not actually to get the advice from.
Not really, because see, today's AI, and you might have read reports of somebody doing a suicide because AI advised him. The AI has not been clinically tested.
Yeah.
Will you ever use a medicine that has never been clinically tested? You will not. There will be AI apps in the future, but there will have been clinical trials done for those apps, will be recommended by the FDA or someone. Till that happens, please go to a therapist. Therapist will give you some advice. You can work with AI on that, but don't exclusively use AI as a therapist.
All right. On that note, Tarun, a pleasure talking to you and having this extremely important conversation. Thank you so much.
Thank you. Thank you so much for having me. It's been great to talk to you. Hi, I'm Tarun. You can catch up with me on Startup to Scale Up only on Hook.